Hello, my name is Tracy Sides, and I'm pleased to moderate today's webinar, Taxing E-Cigarettes, Applying a Proven Public Health Tool to Emerging Products. I'm a policy analyst with the Public Health Law Center, a 501c3 nonprofit located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. We've been a go-to resource for public health law and policy issues for nearly 20 years. We provide legal technical assistance, which includes resources and publications, policy drafting, and webinars like this one. We do not do any lobbying or direct client representation. All of the work that we do is done in consideration of advancing equity. That means that we are focused on partnering with communities and organizations to use the power of law and policy in a way that addresses the social determinants of health and meets the specific needs of all communities, especially those who unfairly bear a greater burden of public health and other societal harms. Today's webinar on taxing e-cigarettes is eligible for 1 CLE credit. We've applied for obtaining 1 CLE credit. And now I'm delighted to introduce our panel of experts who will be speaking today. Ann Boone is Director of Research at the Campaign for Tobacco-Free Kids and will present the compelling reasons why to tax e-cigarettes. Mark Meany is Lead Senior Staff Attorney for Technical Assistance on the Commercial Tobacco Team at the Public Health Law Center and will address the fundamental questions to consider when crafting an e-cigarette tax policy. Molly Moylanen is Vice President at Clearway, Minnesota, and co-chair of Minnesotans for a Smoke-Free Generation Coalition. Molly will provide an overview of where and what types of e-cigarette tax policies are already in place. And Kathy Calloway, who is Director for State and Local Campaigns at the American Cancer Society Cancer Action Network, will wrap up the presentation portion of the webinar with a summary of current legislative activity and key steps going forward. We plan to have a question and answer period following the presentations. You can submit a question at any point during the webinar by clicking on the black Q&A button in the top left of the Zoom window. We'll try to get to as many questions as we can. And with that, I'll turn it over to Ann.
Thanks, Tracy. Hi, everyone. I appreciate the opportunity to speak with everyone today. I just wanted to briefly cover why we believe that this tool is a good way to address the epidemic of youth tobacco use or youth e-cigarette use that we've been seeing recently. So we know that e-cigarette use among youth has reached epidemic levels, and we also know that price is a tool in the toolbox to address this problem. Next slide, please. A lot of you may have seen this graph or version of this graph recently, and it shows, as we all know, the 78% increase in youth e-cigarette use in just 1 year, so that now we're at 20.8% of youth using e-cigarettes. Next slide, please. And this has led the former FDA Commissioner, Scott Gottlieb, to say that e-cigarettes have become almost a ubiquitous and dangerous trend among youth that we believe has reached epidemic proportions. Next slide, please. And the U.S. Surgeon General has echoed this with this quote, also saying that essentially e-cigarette use among youth is an epidemic, and this is a problem that we need to face. Next slide, please. And we're not just concerned about e-cigarette use among youth because of the risk of nicotine addiction, the exposure to other chemicals from e-cigarette aerosol, and of course, the lack of information on the long-term health risks of e-cigarette use. Confirmed that youth e-cigarette use is associated with starting cigarette smoking, and the increase in e-cigarette use has driven an overall increase in the use of tobacco products among high school kids. And moreover, while we often hear people say that, well, at least these kids aren't using cigarettes, the data shows that the kids who are using e-cigarettes aren't necessarily those who would have smoked cigarettes in the first place. In other words, e-cigarettes are exposing a whole different crowd of youth to nicotine, and those other kids have a higher risk of then trying cigarettes. Next slide, please. And pricing is key. We know this because of our experience with cigarettes and other tobacco products. And so, you know, we're used to seeing discounts and advertisements for discounts for cigarettes and other tobacco products at the point of sale. But here are some examples of what we've been seeing more recently with discounts and other sort of price advertising for e-cigarettes at the point of sale. And so, you know, we can tell that the e-cigarette companies are also seeing that price is very important to get new customers. Next slide, please. And because e-cigarettes are relatively new to the market, and the variety of products on the market is very vast and continue to change, and relatively few places at this point tax e-cigarettes, unfortunately, there's very little research compared to the research on cigarette taxes that can tell us about the impact of changes in e-cigarette price on e-cigarette use. And the research that is available tends to be based on older sales data, which are based on sort of older products that have been on the market. However, we know that the fundamentals don't change. We know that youth are more price sensitive than adults, and we also know that there's certain populations that are more sensitive to pricing changes than others. And decades of studies and Surgeon General's reports have shown that the significantly increasing the prices of tobacco products, including through taxes, can reduce and prevent youth use of tobacco products. And so we know that this still applies to e-cigarettes. Preliminary data still show that youth e-cigarette use can be reduced by higher e-cigarette prices. This study that you see on the screen now, it was published in 2017. It looked at e-cigarette sales and prices and e-cigarette use between 2014 and 2015. So it is, again, based on older data. And it has found that higher e-cigarette disposable prices reduce e-cigarette use among adolescents. And it also found that policies that raise retail e-cigarette prices, such as taxes, have the potential to reduce adolescents' e-cigarette initiation and consumption. And again, these are based on sort of slightly older data. This is the pre-Juul market. And so we do have to take some of these findings with a bit of a grain of salt. But again, it just reinforces that the pricing is important and has an impact on youth. We've also seen a few older studies looking at adults' reactions to changes in e-cigarette pricing. And they have also shown that increases in e-cigarette prices will reduce adult use. But again, those studies are based on older data, and so we really are looking for more recent data on the impact of the newer range of e-cigarette products on youth. Next slide, please. In the 2016 call to action from the Surgeon General's report, it suggested that states should consider pricing policies as a way to reduce e-cigarette use among youth. And actually just recently, last week, the World Bank released a working paper or a short report looking at e-cigarette taxation. And it also found that imposing a tax on e-cigarette products is one strategy that can be used to limit youth access to e-cigarettes. So again, these reputable groups have found that pricing is important in reducing e-cigarette use among youth. Next slide, please. So what are we talking about when we just say e-cigarettes? As you can see from the slide, the evolution of products has really changed the landscape. And so when we talk about e-cigarettes, it's important to know that, you know, we refer to sometimes the device, sometimes the e-liquid, sometimes the whole component, the whole structure itself, which is in some cases with disposables, it's the cartridge that is included that has the e-liquid as well as the device. And then, as many of you are familiar with the Juul pods, which are the component of the Juul that actually contains the e-liquid. So we started with cigarette lights that really look a lot like cigarettes to sort of these transition products that kind of look like cigarettes, but were a little bit different. And now we have this vast array of products that are on the market. Some of them are disposable, some of them are not. And so we have to think about a policy that really covers the whole array of products out there. Next slide, please. And so I wanted to just quickly go over how e-cigarettes are regulated on the federal level. As you know, as many of you may know, FDA has jurisdiction to regulate e-cigarette products since August 2016. That has been in effect. And it has, and while currently it covers things like minimum age requirements, and that's set at 18, product registration and ingredient reporting, warning label requirements, and that had been delayed until August 2018, but has gone into effect, and then product review applications. And that the FDA delayed until August 2022 for e-cigarettes, but as some of you may know, FDA has put forth a proposal to cut down that time by 1 year for flavored e-cigarettes. And again, that's still being considered by FDA. That's not final yet. But what the FDA law does not currently cover is childproof packaging, and that's covered by the Consumer Product Safety Commission, flavored e-cigarettes, self-service, and marketing restrictions, such as sponsorships and branded merchandise of e-cigarettes. And then at the federal level, e-cigarettes currently are not taxed at all. And so while some states and localities might depend on, the federal government taxes to help boost their prices, in this case, e-cigarettes are not taxed at all. And so states and localities are the ones who, at this point, can really go ahead and pass their own taxes on e-cigarettes. Next slide, please. So the FDA regulation and federal excise taxes are not the end-all be-all. As I mentioned, states and localities really do have the ability to do their own levels of regulation, and that includes applying tobacco taxes to e-cigarettes, which is exactly what we're going to talk about today, implementing and enforcing smoke-free laws to include e-cigarettes, taking action to restrict the sale and distribution of e-cigarettes, and in addition, passing licensing requirements. And so on that note, I'd like to pass things on to Mark, who is going to talk a little bit more about the fundamental things to consider while taxing e-cigarettes. Thank you.
Great. Thank you very much, Anne. And thanks to all of you for joining us here today. As Anne and Tracy said, I'm Mark Meany. I work here at the Public Health Law Center. Anne did a great job of laying the foundation, both for where the state and local authority for taxing e-cigarettes lies, and also some of the policy reasons why we should consider taxing e-cigarettes, some of the goals that we hope to achieve. I'm going to take this a step forward and talk a little bit more about some of the nuts and bolts of what a good tax on e-cigarettes might look like, assuming we move past the first question on whether or not a tax makes policy sense. So we've been working in the area of e-cigarette taxation for a number of years. And so I'm going to talk about some of the background questions that we think that you should consider asking yourselves prior to enacting an e-cigarette tax. It's an area of tax, I think, that remains deceptively complicated. And some of the questions that we get asked, we still are kind of working through and learning more about them. But some of the, kind of the fundamental baseline questions and some of the pieces of information that are important to consider beforehand are, of course, which products should be taxed, what's the appropriate level of taxation, how the tax should be structured, kind of where in the current tax stream, whether it fits in the existing structure and how it can fit, because these are kind of unique products. Are there unique enforcement and implementation challenges with them? And then the spoiler in that is, yes, there certainly are. And then legal concerns. I think, mandated to talk at least about one piece of litigation, and because we live in a litigious world in the tobacco control community, it's important to be aware of the potential for litigation. And as Anne talked a little bit about the evolution of e-cigarettes, I think this is an important point to bring home, because when we talk about e-cigarettes, I think everybody has a little bit of a different image in their mind on what that means. And I think this universe of products is very large. And when we first started talking about this, both in terms of general e-cigarette policy, but in terms of taxation specifically, we were really talking more about the cig-alike products, and that kind of moved more to some of the open-end systems. And then more recently, I think Juul has, because it's dominated the market, I think it's dominated people's perception of the products. But I think it's also important that we think about all these other products that when we talk about e-cigarettes, at least from a tax perspective, and really from any policy perspective, we're talking about a universal product. And then the slide that you're seeing now is an example of products that were confiscated in one school district. So these are products that are currently being used and used by youth. So of course, the basic question for any, the fundamental question is which products should be subject to the tax. And this is kind of a continuum. We see this going from, I think any tax on e-cigarettes, of course, is going to include the nicotine solution or any solution that contains nicotine that's derived from tobacco. And that's going to be, I think, kind of the fundamental. But with every expansion on that, and we certainly think a broader based tax is warranted, there are policy considerations. And because this is a unique policy area and because some of the products are being manufactured on site, those become even more pronounced for the taxation. So jurisdictions have moved beyond just the solution with nicotine to include all e-solution. And that has been important because we know that there's a lot of mislabeling, that there's a lot of products that are purported to either include nicotine that's derived from something other than tobacco, or that claims to be nicotine free and that it actually is not. And so there is an enforcement problem often with not including those products. And the other part of it is also, I think the policy justification is that it's not, these aren't safe products regardless whether they contain nicotine or not. And then beyond that, it's also, there's a question of whether the devices themselves should be subject to the tax. And it's certainly within a jurisdiction's authority to include them. And our suggestion, our recommendation typically is to have a very broad-based tax to include the devices as well. What we've seen is again, a potential policy problem is if just the solution is included in a tax and the device is not, there becomes a question of apportionment and how much of the tax is attributable to, or how much of the cost attributable to the taxable product, which is the solution, how much is attributable to the device. And that can become very difficult to ascertain and to kind of determine which is the taxable part. So a broader based tax seems certainly legally viable and achieves policy goals as well. As with any good policy, and I feel like this really gets back to the fundamentals of any good policy, it's so very important. I can't emphasize this enough, the importance of clear, concise definitions for what is, for everything, but in this case, for what is being taxed. There's so much litigation that is initiated based on vague definitions. Determining what your policy goals are, including the device. Our suggestion is probably not to include separate component parts that are not part of the functioning device in the taxation in the tax itself. And then it makes a lot of policy sense from our perspective also to include them as under the definition of tobacco products. The next question that we get a lot of questions on, and I think there's a lot of debate about, is what is the appropriate level of taxation? And this is, again, I think it's important to step back a little bit and think about this universal products again. It's not just the cig-like products, it's not just the Juul products, but it is the whole universe. And that makes it kind of difficult to determine what is a parity level with cigarettes, because as I'm sure you know, cigarettes are taxed, each state taxes cigarettes based on an amount per pack. And so some states, California has worked to come up with a number each year to basically determine what the equivalent rate is. But I think that can be kind of difficult. There's a lot of push to tax them at a lower rate than certain other products based on their perceived risk. And that also is a little bit dicey. It's hard to know. Again, this is a large universal products, and it's also an emerging universal product. So we don't know what's coming next. We don't know what the different rates of risk are for the products. And we haven't, I think that makes a very administratively difficult approach. Again, and I think we can look at all tobacco products and they all have different risk profiles. And so for any state to have to, or local jurisdiction to make those determinations is extraordinarily difficult. And then the other side of that is there is a process, and Kathy's going to talk a little bit about this, the modified risk part at least, at the FDA, where products can be designated as lower risk products. Or alternatively, and I think this is what we hear a lot when people oppose e-cigarette taxation is, if they are truly cessation products, there is a process, as we know, in the FDA to make that determination. And so we recommend not to tax the products that have received FDA designation as cessation products. And again, I think our best case at this point scenario is to tax them at the same rate as other tobacco products. And typically this is non-cigarette tobacco products. Next, how is the tax structured? And Molly is going to talk more about this specifically and how states have done it. So just kind of the general overview is an ad valorem tax, which is often how states tax other tobacco products. And ad valorem just means according to the value. So typically this is a percentage of the cost, whether it's the wholesale or the retail price of the product. And what is kind of advantageous about an ad valorem approach is that it allows a group of products to be all taxed, as one under one tax structure, so they can be the same percentage rate. Also, what's nice about ad valorem taxes is that they are, in some sense, inflation proof. So as the price goes up, the tax rate goes up as well, and doesn't have to require going back to the legislature to change the tax over time. We've seen a lot of jurisdictions that tax them by volume, and typically this is a very low tax rate. 5 cents a milliliter is a very common rate that we have seen, and I think it's important to put this in some context that the Juul pods themselves contain about 0.7 milliliters of e-solution. So if the product is just being taxed, just the solution is being taxed, and just at a volume rate of 5 cents per milliliter, that is the equivalent of about 3.5 cents per Juul pod. And as we know, a Juul pod is essentially equivalent to a pack of cigarettes. So you can see that there's a huge disparity between that and a cigarette tax, regardless of which state you're in. We've seen jurisdictions consider taxing by concentration of nicotine. Again, I think that's a very difficult proposition because we don't always know what the nicotine concentration is. And then the last part of this is, where is the tax collected? And again, this is unique. E-cigarettes are unique to other tobacco products because they're not kind of this widget product where it's manufactured, packaged, and then sold entirely. Some of them are manufactured at the point of sale. And so there's, of course, a pretty significant increase in the value at the point of sale. So some jurisdictions are considering, and I know Kathy's going to talk more about this as well, collecting the tax at the retail level. But I think in most cases, it's still being done at the wholesaler or distributor level so that it fits in with the existing tax structure, which does also make a lot of policy sense. So implementation and enforcement, this is always such an important and often overlooked part of any policy, and I think tax is no exception to that. But some of the key issues that are important to consider on the front end, of course, I think, and it's important to talk to the folks who are doing the implementation and enforcement to make sure that the system seems like it's going to work. But effective licensing, I can't emphasize how important that is. Otherwise, it's impossible to know who's selling the products. It has, the ability to include penalties for non-compliance, and so it's, I think that's a fundamental component of any good tax policy system. The burden of proof, and again, this would be in the case where a jurisdiction chooses to only tax the products that contain nicotine. So we know that often the products are mislabeled. So having the preponderance or having the burden of proof, assuming that all products contain nicotine, is a good approach for that. And having a laboratory to make those determinations. We know a lot of the products are sold through internet sales, and so often that is a way around the taxation. So considering how to address that is very important. And then evaluating the effectiveness, having targeted where the revenue is going to be targeted so that it does benefit tobacco control, and then also looking to see how much revenue is generated and that it's working, and also, you know, what the policy outcomes are in terms of youth use. I think these are all important pieces to try to build in if possible. And then my final piece is on litigation. As I said, and we all know, we in the tobacco control world live in a very litigious environment, and tax is not quite there yet, but we know that it's going to get there. One of the questions, there's been a couple key lawsuits, one in Chicago that's really, I'm not going to talk about today because it's really related mostly to some local kind of jurisdiction specific issues. But in Pennsylvania, in the East Coast Vapor versus the Pennsylvania Department of Revenue, there was litigation that really looked at questions that we receive very frequently. And it's a question of whether a state can include products that don't contain tobacco or nicotine derived from tobacco in a tobacco tax. And this was in the Commonwealth Court of Pennsylvania, so it's a state court. It doesn't have precedential value outside of the state, but it still is helpful, and it could be very instructive to other jurisdictions that are considering a broader-based tax. In this case, the court said it was, you know, there was a challenge based on state and federal constitutional substantive due process claims. And basically, the court said that no, it's okay that they include the devices, and those were the court allowed those to be subject to the tax. There was a question of whether e-solution that contained nicotine derived from something other than tobacco could be taxed, and the court said that was absolutely fine. They didn't reach the question of whether there was e-solution without nicotine could be taxed, just because there hadn't been an issue of that being enforced yet, but it didn't seem like there was any indication that it wouldn't. So our view is that the definition, the term of the defined product doesn't matter so much as how the product is defined. And so if a good comprehensive definition should mitigate the likelihood of a successful legal challenge. So with that, I'm going to turn it over to Molly.
Thanks, Mark. Can everyone hear me okay, or can someone? I'm assuming that's a yes. I bet everyone else is on mute. Well, thanks again for having me and including me on this webinar. And Mark, thanks for the introduction. So I'm going to be talking about what states are taxing e-cigarettes and a little bit more as to how they are doing it. Next slide, please. Thanks. So everyone should know that the Public Health Law Center has some excellent resources on e-cigarette regulations on their website. In fact, they have an interactive map that lets you view and compare many types of regulations this way. They also have a summary of e-cigarette regulations by topic area. And this here is a screenshot of their taxation grid. So you can see right now what states are indeed taxing e-cigarettes and when their implementation or effectiveness date was. Next slide, please. So what I did is I just took from their state-by-state list, I created a quick table to highlight the 10 states that tax e-cigarettes. And this chart, just for a reminder, is current as of December 15th, 2018. Also, this is only looking at states with special e-cigarette taxes, special taxes, or excise taxes. This does not include regular plain old sales tax on e-cigarettes or devices. I'll note here too, just that Minnesota was an early adopter, and I'll talk more about our experience in a little bit. Since December of 2018, since this chart was created, there's been a lot of discussion and debate on this topic happening around the country during legislative sessions, and Kathy's going to talk a little bit more about this later on. All right, next slide, please. As Mark already outlined, there are generally two approaches to taxing e-cigarettes. First, the ad valorem approach, or percentage of price, and second, a set amount per unit of liquid nicotine. So for shorthand, we'll call that per unit. I'll also add that generally the public health community prefers the ad valorem approach because it tends to result in a higher tax burden than the per unit tax and therefore have a higher public health benefit. And conversely, the per unit approach is preferred by industry because it results in a lower tax burden than ad valorem. And in fact, we know in most cases, in the states where there is a per unit approach, industry was really driving that policy change, not the public health community. Next slide, please. All right, so there are 3 states and the District of Columbia with an ad valorem approach, and they're each a little bit different, both in their percentages and, like I said, their overall approach, or how they come up with their percentages. So in Minnesota, we have an ad valorem tax, which is 95% of wholesale price, and this is the same tax rate that applies to all other OTPs, other tobacco products. Now in Minnesota, our tax only applies to products containing or derived from tobacco. For example, the tobacco tax on an e-cigarette starter kit is calculated on the total cost unless the nicotine cartridges are sold separately, and then the tax would only be on the nicotine cartridge value. Similarly, a disposable e-cigarette may have the tax calculated on its nicotine cartridge value if the cartridge is replaceable. Now, as Mark has just described, in contrast, we have Pennsylvania's tax. Now, it has a lower rate than Minnesota's tax, but it's applied not only to products containing or derived from tobacco and nicotine, but also the accessories and parts that are used. So, as you have just heard, right, this was challenged, but for the most part has been upheld. So, to Mark's point, as you're thinking about, or states are pursuing e-cigarette taxes, it's important to have that broad definition and make sure that you're using the ad valorem approach if possible, as well as looking at incorporating devices. Now, both California and the District of Columbia have a tax rate that is variable because their policies dictate that the rate should be at an equal rate to the pack of cigarettes. So this will vary over time, but it is generally an ad valorem approach. Next slide, please. In terms of the per unit approach, again, each state has a slightly different language and different amount, but this simple outline captures really the bottom line. For the 6 states with a per unit tax, you know, we can tell here that they're not collecting much, and it's not having a big impact in terms of deterring use. So we'll see 10 cents per fluid milliliter in New Jersey, 7.5 in West Virginia, 5 cents per fluid milliliter in Delaware, Kansas, Louisiana, North Carolina. Now, Chicago is also worth mentioning because they are really an exception to the statement I made earlier regarding the preference by the public health community versus industry. Chicago has taxing authority, but they can't do ad valorem taxes. So because of their limits, they went with a per unit approach, but made it high enough, really with hopes of driving down use. Next slide, please. Now I want to take a minute to share a little bit more about Minnesota's experience taxing e-cigarettes, and specifically how it happened and what challenges we have and continue to deal with today. So next slide, please. In 2010, working with 2 of our longtime legislative champions, we introduced the Tobacco Modernization and Compliance Act. We wanted to use this legislation as a way to shine a spotlight on the tobacco industry's latest efforts to addict new and younger customers through sneaky, cheap products. We wanted to connect with lawmakers and build towards a future state tobacco tax increase. And then we also wanted to build towards a significant comprehensive tax when we had that right window of opportunity. And that came about in 2013. Next slide, please. The crux of our bill was updating our cigarette and tobacco product definitions to ensure we were capturing new products across really all regulations, including taxation, but also minimum price laws, promotional distribution, youth access, and licensing. So as crazy it may sound now, at the time, the advocate, the public health community, lawmakers, and our Department of Revenue, we weren't thinking specifically how this new definition did or didn't apply to e-cigarettes. We were really focused on flavored little cigars and dissolvable products, which we were thinking were starting to catch on more and taking hold in communities. But we know now that wasn't the case. Next slide, please. So in 2010, our bill passed with strong bipartisan support, and in 2011 and 12, we really shifted our focus to increasing our overall state tobacco tax rate. During this time, e-cigarettes were gaining popularity, while dissolvables and snus and other products were really fading by the wayside. In October of 2012, the Department of Revenue here in Minnesota issued a revenue notice stating it was their position that e-cigarettes are indeed a taxable tobacco product. Now, we were excited, thrilled, and a little taken by surprise because we hadn't been communicating with the Revenue Department much since the 2010 bill passed. But in fact, our Revenue Department had started taxing e-cigarette products that they could find as tobacco products after that 2010 bill passed. But they didn't issue this formal notice until 2 years later when e-cigarettes were really growing in popularity and variety, and there were more questions about the taxation laws in Minnesota coming from industry. All right, next slide, please. Now I'll just talk through some of the challenges we've seen here really through our Department of Revenue. By far the biggest challenge that the Revenue Department has encountered is isolating the taxable transaction. Traditionally, tobacco product manufacturers were different and distinct from tobacco product distributors, who were different and distinct from tobacco product retailers, right? The supply chain was stable. It was fairly easy to trace the sale and the transfer of the products from manufacturer to distributor to retailer, and to tax and audit those appropriate transactions along that chain. So according to the Revenue Department, they were having a lot less compliance issues. They have been having fewer compliance issues with distributors who deal with traditional tobacco products and cigarettes. However, with the newer independent e-cigarette retailers, it's really been a whole new ballgame. Many open system e-cigarettes are distributed through non-traditional channels such as the internet and trade shows and direct sales. In addition, individuals are buying the raw nicotine themselves and are manufacturing, distributing, and selling e-juice all themselves. They are every part of that chain. In Minnesota, as Mark talked about the different levels of licensing, the tax is applied at the distributor level, but compliance is done at the retail level. So the DOR and our Revenue Department auditors really go into retailers and audit for tobacco tax compliance by looking at receipts between the distributor and the retailer. With open system e-cigarette retailers, in many cases, there is no receipt to audit because the product was obtained through non-traditional channels, and the distributor wasn't even licensed in the first place. So there was no, formal distributor. Over time now, as more retailers learn about the tobacco product distributor license requirement in Minnesota, many are simply becoming distributors and complying with the tax. We've seen the number of distributor licenses in Minnesota skyrocket over the past few years. Next slide, please. So there are a number of other challenges that are also worth noting. First, there's really been a lack of action or infrastructure provided at the federal level. Second, lack of resources and capacity to carry out good tax compliance activities with this huge increase in distributors and retailers. Third, to Mark's earlier point, because Minnesota doesn't bifurcate the e-cigarette tax revenue from other OTP revenue, we can't be sure how much revenue is coming from e-cigarettes, and this information would be so helpful to help us track trends in revenue, consumption, and also the possibility of dedication for prevention. Fourth, while we prefer the percent of a price approach, it's really been a challenge to come up with what ultimately should be taxed. According to our statute, the products needs to be, quote, suitable for human consumption. And the Department of Revenue has struggled with manufacturers who want to pay the tax on the wholesale price of a bucket of 100% pure nicotine, which is not suitable for human consumption, versus the individual bottles of e-juice, which is suitable for human consumption. Fifth, our Revenue Department has been approached by some e-juice manufacturers claiming that their nicotine was not derived from tobacco, but rather from tomatoes. And the Revenue Department, as Mark has said, they really put the burden of proof back on the manufacturer, and indeed these manufacturers have not pursued it and have not been able to prove otherwise. And finally, sixth, we know that the Department of Revenue was sued and the case ultimately was settled, and we don't know all the details, but we do know as a result of this litigation and settlement, the Department of Revenue is pushing for more clarification to prevent future litigation. The next slide, please. So my final slide, I'll talk a little bit about what our Department of Revenue is pushing for right now. They have been proposing a standalone definition for vapor products outside of the tobacco product definition. And the public health community has really pushed back on this because, as we know, once you create a new product category, it's easier to reduce or eliminate the tax altogether under a less friendly leadership. That said, because of the litigation, they are really committed to adding this new definition. And so with that in mind, we've been working with them to improve their language so it aligns with public health language and not industry's nomenclature. In anticipation of synthetic nicotine made in labs, they're also proposing new language that captures both natural and synthetic nicotine. And finally, while their bill this year, I don't think includes requests for additional resources, more money to improve their overall tobacco tax collection and enforcement system, this is something that we have and will continue to support in the past and in the future. So with that, I think I'll pass it to Kathy, who will talk about what's happening outside of Minnesota right now during legislative sessions around the country.
Thanks so much, Molly. Hi, everyone. I'm Kathy Calloway with the American Cancer Society Cancer Action Network. As Ann mentioned, we began 2019 facing an epidemic of e-cigarette use among youth, causing a 36% spike in overall youth tobacco use. This was a single-year increase like we've never seen before. So it seems logical that we would fight back with the most effective tools in our toolbox. We know regular and significant tobacco tax increases are one of the most effective ways to reduce tobacco use. Next slide, please. Unfortunately, Big Tobacco, including Juul, knows this too. And as a result, we have yet to see a significant cigarette or tobacco tax win this year, though there are still some promising bills in play. Tobacco companies and their allies have a long history of distorting the issues and diverting the energy of tobacco control coalitions and lawmakers into policy debates which avoid the most effective interventions. These policy diversions are smokescreens that merely give the appearance that something has been done to address the problem without actually doing so. Middle of the road and new lawmakers sometimes find these flawed alternatives appealing as a way to take some public credit for addressing the issue without requiring them to go against the will of the tobacco companies and their allies. While some of these issues may seem to have some merit, they have also been used as vehicles this year by the tobacco industry to lay groundwork to prevent future action or regulation. Preemption has been the big red flag attached to some of these issues this year, but some of the language changes are more subtle, and unfortunately, we'll be dealing with the impact well into the future. Next slide, please. For years now, the tobacco companies have worked very hard to prevent electronic smoking devices from being defined as tobacco products in state laws. If they aren't defined as tobacco products, they won't be regulated or taxed as a tobacco product. They know we want the entire electronic smoking device taxed, and history tells us taxing all tobacco products at a parallel rate helps people quit rather than just switch to the cheapest tobacco products. So what does the tobacco industry do? They focus terms and definitions on the cheapest part of the product, so in the event it is going to be regulated and taxed, it will only be on the contents rather than the entire product, which, as Mark explained, results in a low tax that will likely have no impact on consumption. These are all terms we've seen in legislation this year to lay the groundwork for low taxes. Next slide, please. Pennies per milliliter of liquid nicotine or pennies per milligram of nicotine is the preferred industry approach, as Molly mentioned, and it's the approach that we continue to see most frequently. This is an example of language we saw in a bill in Indiana this year. Ultimately, the legislature did nothing and instead kicked the issue to an interim study committee. Next slide, please. When we have been able to establish ad valorem tax in legislation this year, the amount of the tax is frequently being negotiated down. This is language that was passed in New Mexico, applying a tax at 12.5% of product value. In addition, New Mexico passed language that separated out what they called closed system cartridges, like Juul pods, and taxed them at 50 cents per closed system cartridge. At the same time, in Washington, there is an ongoing effort to establish a tax on e-cigarettes. They are proposing 37% of the selling price on the retail sale, with the revenue from the tax going to cancer research and tobacco control. Unfortunately, both of these approaches are lower tax rates than we'd like to see in these states, and neither of them are increasing the tax significantly on cigarettes at the same time. 36% would be parallel to New Mexico's current cigarette tax, and 25% would equal New Mexico's current tax on other tobacco products. So the 12.5% is much lower. In Washington state, 65% would be parallel to Washington's current cigarette tax, and 95% would equal Washington's tax on other tobacco products. So again, the 37% is much lower. Next slide, please. Another preemptive strike that we are seeing this year by the tobacco industry is the introduction of language to lower the tax on any tobacco product that FDA has authorized to be marketed as a modified risk tobacco product. The Tobacco Control Act, granting FDA authority over tobacco products, includes a provision that requires a tobacco product manufacturer to receive a marketing order before they can make a modified risk claim about that tobacco product. The reason for this provision is because the industry has lied for decades about the harm of their products. Now a tobacco product manufacturer must prove that their product, when actually used by consumers, will benefit the health of the population, both users and non-users, before they can make any such modified risk claim. FDA has not approved any modified risk tobacco product marketing orders to date. Any action at the state level is premature, and we encourage you to oppose these efforts. We don't know what these products are or what they will be, how they will be packaged or marketed. It's too soon to decide how they should be regulated at the state level. Next slide, please. Here's the language to be on the lookout for. So far, it's been pretty straightforward. Reduce the tax by 50% and 25% for products with a modified risk tobacco product order. Next slide, please. Philip Morris has submitted a modified risk tobacco product application to FDA for their IQOS product, which is pictured here. Even though it hasn't been approved yet, Philip Morris has been busy in Virginia, where their corporate headquarters are, laying the groundwork to ensure these products are regulated and taxed differently than cigarettes and other tobacco products. The Virginia legislature created yet another term and definition of heated tobacco product, which will seemingly capture the IQOS product. This bill also defined liquid nicotine, alternative nicotine product, and nicotine vapor product, which are all separate from the definition of tobacco product, which is also defined in the bill. These various definitions will prove to be problematic and challenging as we try to regulate all of these products in the same manner as cigarettes and other tobacco products. Next slide, please. Once again, the Virginia legislature delayed doing anything in favor of continuing to study harm reduction options. And this is the language that was in the Virginia bill. I think we are up to at least 5 states that will be convening interim study committees on taxing tobacco products. And that means that those are 5 states that didn't do anything to increase the price of tobacco products this legislative session. Next slide, please. So at this point, we still have a lot of work to do, but the good news is we know what works. Look everywhere. If the industry likes a bill, there must be a reason. Regular and significant tobacco taxes, smoke-free laws, full funding for tobacco control programs, and comprehensive cessation coverage remain the most effective policies to reduce tobacco use. Don't lose sight of this. Prepare lawmakers for the industry delay tactics and other tactics. If your state is having an interim study, engage in the process and share your stories with us. We learn from each other and it helps us do our jobs better. We're here to help, from language and definitions to campaign strategy. Give us a call. Thanks for your time today, and I'll turn it back to you, Tracy.
Excellent. Thanks, Kathy. And thank you to all our speakers today. We do have time for at least a few questions, so let's jump right in. We've gotten several through the chat box and the Q&A. Feel free to submit more. First of all, we had someone asking if we could repeat the name of the report that Anne mentioned, and that's a World Bank report called E-Cigarettes Use and Taxation that was released on April 1st. So you can find that on their website. Next, we've got a question. Is there a model e-cigarette definition for a statewide e-cigarette tax? And maybe Mark will let you start with that.
Sure, and again, I think this also depends on the policy approach that a state is considering. But we do have, and I would encourage you to contact me after the webinar. I'd be happy to provide to you our model definition or our sample definition for that. And I know that Kathy also works on and has model definitions as well on this that I think are very consistent with ours. I don't know if Kathy wants to speak to that.
Yeah, happy to help anyone drafting legislation for your specific jurisdiction at any time.
Great. We also had a question wondering about examples of how much revenue states actually are bringing in to the extent that that can be answered. I don't know if Molly, do you have any examples of that, or anyone else?
Oh, it's a good question, and there is some general outline of that in a report that we've seen, but I don't have it at my fingertips right now. Mark or Anne, do you know the report I'm talking about?
Oh, sorry, go ahead, Anne.
Oh, well, I was just gonna, the report is out of Louisiana. I don't have the numbers off of the top of my head, but it is important to note that generally the tax revenue from e-cigarettes is much lower compared to the tax on cigarettes. Consumption of cigarettes is still pretty high relative to e-cigarette consumption. And, obviously it depends on the tax rates. But I think states that might look to e-cigarettes to plug revenue holes or things like that, or budget holes, I'm sorry, shouldn't necessarily depend on e-cigarettes alone to do that, because again, we just know that generally looking at increasing taxes overall on all tobacco products would be not only the best for public health benefits, but also for revenue. It would generate the most amount of revenue.
Great, thanks. We've got one. Kathy, maybe? Do you want to start with this one? Are there best practices for uses of e-cigarette tax revenue?
Well, certainly from our perspective, using the revenue to further prevent tobacco use and to help people quit would be the ideal use of any tobacco tax revenue.
Okay. We've got one also about specifically relation to the e-cigarette taxes in Minnesota, Pennsylvania, California, and DC. If those taxes place them in parity with combustible cigarettes. Let whoever may have a comment on that to just jump in.
This is Molly, and I can start off, but Kathy, Mark, others, and jump in too. In Minnesota, the 95% taxation on wholesale price is the same as our rate on all other tobacco products. So it's in line with that. And that rate, 95% of wholesale, there was some calculation done to connect that to the pack, to the price per pack or the tax per pack of cigarettes. So there's alignment with both. In DC and California, they have independent boards that are charged with setting their percentage of price on parity with cigarettes, is my understanding. So they independently look at the price and the tax of cigarettes and then set that tax rate on e-cigarettes accordingly.
I think that's great, Molly. That's very accurate. I would also, I think it's always important to remember that what is complicated about that question, I think, is that, again, we were talking about this whole universe of products. And so tying it to combustible cigarettes can be very difficult because there's a large differential among the products in terms of their price. And then also the scope of what the tax includes. If it's just like, for example, Minnesota's, which is a percentage of the the e-solution versus Pennsylvania, which includes the devices themselves. The percentage, the ad valorem rate itself, while very different, might result in also a different amount overall that would change the calculation on whether it is close to being on parity with combustible cigarettes. So I think it's a tough. There's no simple answer to that, but I do think that California does a very, I think, thorough job, and once a year comes up with a one rate that e-cigarettes are taxed at, and I think it's 60-some% for this past year, and I think that's coming. They do it in the spring of each year. It's intended to try to make it the equivalent of the combustible cigarette rate, but I do think it's a really hard thing to get your head around.
Great. I think we've got time for one more. And the question is, what would you suggest in working with a local or state government with a federally recognized tribe that both support local taxes in the same jurisdiction? So thoughts on partnerships with tribes and state or local government?
Mark, I might defer to you on this one, but I think, certainly working with your governor's office and understanding the compact process that the state usually convenes with tribes would be an important step in that process.
Absolutely, and I think it's working with the tribal community and determine what their policy goals are and what works best for them. I think that's it's their unique jurisdictional issues, and I think it's important to understand what the policy goals are. So I don't think there's a great answer that's different, other than it's important to gather as much information and to work with tribal leaders in helping them to achieve their goals.
Great. And we do know that there have been efforts made by e-cigarette companies to make headway into tribal communities. So this is a very timely and important question and an area for collaboration. So just want to wrap things up now. We want to thank everyone for participating, both those of you online as well as our panelists. And a recording of this webinar will be archived on the Public Health Law Center website. Those are usually up within about 24 hours. Thanks, everybody.